my name is Debbie, and I work at Tufts Medical Center part-time as the Injury Prevention Coordinator. And basically, my role is to go out in the community and remind people and keep people up to date on the latest research that's out there to prevent any type of injury. So today is the very first day of autumn, and on the first day of autumn, or first day of fall, we usually have a Falls Prevention Awareness Day because it falls on the first day of fall. And this year, with the National Council on Aging and also the Massachusetts Falls Prevention Committee coalition, we've decided to do a whole week celebration and awareness on falls prevention. But this program that you're going to be participating in is a 4-session program. So this week, I'll be sharing with you different ways, some facts about falls, and also some exercises that you might want to do and start adding on to your regular routine. I am going to keep this hour engaging. So if you have any questions, please put them in the chat. And also, at the very end, last 10 minutes or so, I will open it up for more question and answers, okay? And whatever I don't cover this week, I will cover next week, depending on the questions that come up. All right, so I'm going to do a screen share. All right, so before I dive into any type of information, I just want to remind people, you know, whatever information I share with you, just sit with it and know your body. The information that I share with you is not meant to replace any type of treatments or plans that you have with your doctor. Always consult your doctor if you're not sure of any type of treatments or suggestions that I share with you. And so I just want to make sure that, you know, whatever I share with you is more to supplement your overall health and well-being. All right, so I like to start with this slide because this slide is a nice reminder that we are all in this circle of life, I like to say. Every phase in our life, there's always something to be learned, whether it's a baby, being babies and learning how to walk and crawl, being toddlers, adolescents, teenagers, adults, aging adults, there's always something to be learned in every phase in our life. And because of that, we need to learn to maximize what we can and what we can do. And also in a way, become aware and accept what we cannot do at that moment. So as we are aging, there are going to be things that we were able to do much better than when we were babies, but there's going to be some things that it's going to make it a little bit slower for us to do as we get older, but it doesn't mean that we should stop. All right, so falls are not a part of aging. A lot of people feel that it is, but it really is not a part of aging, and that's why basically I'm here, is to remind people that most falls are preventable. They are preventable if we can just take actions that's going to create better success in our lives. So whether it's moving more or decluttering the things that are on our floor or in our surroundings that's going to maybe put us at risk for falling, or being careful when we're walking outside. Just being careful and purposeful in what we do is very, very important. It can be really tough though because of what's going on, especially now with COVID. We've been riding in such uncertain times. The times, the climate, the seasons has been so up and down. It's hard to know what's right in one moment and what's wrong or what we shouldn't do the next moment. So it's really there's a lot of discrepancies in the news as well, and also different information. So there's a lot of uncertainties and a lot of distractions, a lot of different information coming and going. It's really important for us to be able to discern what is right for us and what's just right for us and what's enough for us. And when we can do that, then we can filter away things that's going to keep us from being unbalanced or insecure or anxious or stressed. So just to let you know, everybody is feeling it. Children, adults, aging adults, everybody's feeling it. It's just the way it is right now. And one of the best things that we could do for ourselves is to just take it one moment at a time and one day at a time. So what I'd like to cover in this hour, in the first week of the series, is falls. What are they? I know it's really a basic thing. You know, everybody knows what falls are, right? But I just want to share with you some of the, definitions, some of the qualities that are considered falls. Also, I'll talk about some risk factors that can lead people to falling and how we could reduce that, and also some exercises that we could do. All right, so what are falls? Well, falls basically is anything or any time that you land on something unintentionally, okay? Whether it's you tripping and you catch yourself. You don't have to be hitting the ground for it to be considered a fall. It's just anytime you lose your balance and you catch yourself, okay? So it could be slips or trips, whatever it is, and it can be with or without injuries, okay? So you don't have to be injured for you to consider it a fall. All right, so the Center for Disease Control and Prevention, the CDC, we've been hearing a lot about them the last few months, right? According to them, 1 in 4 people over the age of 65 and up fall every year. So basically, it's like if you were in a movie theater and you were sitting on a 4-row seat, one of the people sitting in that 4-row seat, 1 in 4 will fall, okay? So that's just something to kind of think about. And also when people fall, half the people tell their doctor. Half the people tell their doctor. And also, once people fall, it doubles their chances of falling again. And right now, this is just the latest data. About 3 million older people are treated in the ER for fall injuries. So I mentioned before, I work at Tufts Medical Center. I work in the trauma department. And one of the emails that I get every day are the list of people who gets admitted through the ER and also who gets admitted under the trauma service. And I can tell you there's a lot. About at least 80 to 90% of the people who come in gets admitted through the ER and falls under what's called the trauma service. A lot of them are fall related. A lot are fall related. It could be falls going down the stairs, tripping, could be falls just from sitting. Person could be sitting and they're reaching for something and they fall. It could be somebody slipping. They could be tripping. They could be out on the street, walking, and maybe they miss their step. And the thing is, when people fall, especially as we get older, and especially if people are on medications that are like blood thinners, that's really very concerning. So people get admitted to the ER and they stay there, they get admitted, and depending on the severity of the falls will depend on how long they stay in the emergency room. Okay, so just a quick check-in, something to ask, have you or someone you know fell over the last year? Okay, just kind of think about it. If the answer is yes, maybe you could ask yourself even more, how about in the last 3 months or the last month? And also asking, when you or someone you knew, someone you know fell, did that person tell anybody? Did they tell a family member or a friend? Did they tell their doctor? Another question to consider is, was there any injuries involved? Were you hurt, or was that person hurt? And this hurt could be, was there any bumps and bruises? Was there any scratches? Or was there any broken bones? Another thing to ask and consider is, if that person, if it was you, the person that fell, did that incident made you feel afraid of falling again? Because that's also a risk factor. Fear of falling is a big risk factor for people, because then what's going to happen is going to change what they do every day. Okay, so these are just some questions to think about. At Tufts Medical Center, we do like to ask people if they have fallen in the last 3 to 6 months. And also, we like to know what people's medications are, where they were, what they were doing. One of the common places where people fall at home is the bathroom. Could be the kitchen, could be the bedroom, but typically it's the bathroom. And forgive me if I don't see any of the chat, because I'm not seeing that here with my slides open, but definitely I will save some time at the end for question and answer. So just write down your question and answers, and then we'll be able to address them towards the end. Okay, so fear of falling, I put that in the center here because it really can impact the way you start living your life. Once a person falls, there are a great chance that they're going to be afraid of falling again. And that's going to impact, ADLs is a nursing, or it's a medical term for activity of daily living. So anything that you do, whether it's going up and down the stairs, going outside, doing your gardening, going to the kitchen and preparing meals, going to the grocery stores to buy your groceries, cleaning your bathroom, folding some clothes. These are activities of daily living, things that we normally typically would do to live, right? But what happens is, when we start fearing falls, then we start doing less and less of these activities. And what's going to happen is this negative spiral. It's going to make us not want to move as much, because we feel like we'll be safer if we don't move as much. We'll just be safe sitting on our seat, or staying in bed, or maybe just staying in one room. But what happens is, our body becomes deconditioned. It becomes weaker. So here, our body will become weaker. And with that weakness, our ability to control our muscle groups and our whole body, our balance is going to be off. And with our balance being off also, and the weakness, our endurance, our stamina is going to go down. And with the weakness, the balance, and low endurance, our coordination is going to be off. And with the weakness, the balance, and endurance and coordination being off, our confidence and our ability to do our typical activities of daily living is going to go down. And then it just keeps spiraling down and down and down. And it makes the fear of falling be the center of that person's life. So some of the risk factors that can contribute to falls are changing body, our aging body, our medical conditions. Okay, some people may have a heart problem. I used to work on a cardiology unit, and sometimes people would have an arrhythmia. The rhythm would be a little bit off, and that can make them feel anxious and short of breath and keep them from really being active. Or sometimes people would have a congestive heart failure where they retain a lot of fluids in their legs, maybe around their heart and their extremities, and it weighs on them because that's extra fluid and it keeps the heart from pumping really well. Or I used to work in a medical surgical floor. People would sometimes come in with asthma exacerbation. They can't breathe. So they're very short of breath. So all these different medical conditions can lead to us not moving as much because we can't, even though we want to. Surgical histories can also be a risk factor because people could have a knee surgery or hip surgery or back surgery, and it's going to maybe keep them from moving the way they used to before. Okay, hopefully they're able to move a little bit better. That's why they had the surgery. But sometimes there are complications or arthritis that sets in that keeps the person from moving as well as they did before. All right, another risk factor, as I mentioned, is a decreased daily routine. Okay, so a person who would typically clean their house up and down, second floor, first floor, basement. They clean the windows, they do the gardening, they do the shoveling. As we get older, that could be less and less. But also after a fall, maybe that can also become less and less because we're afraid of falling or hurting ourselves. Another risk factor are the environment in your home or outside. So in the home, being careful of clutter. So things that could be if you have children or grandchildren or pets and they might have toys on the floor, or maybe there's a water spill, or maybe a broken cabinet and the door keeps opening, or even in the middle of the night, it's getting cold. So I've been needing a lot of blankets. So in the middle of the night or before you go to bed, you might have a lot of blankets on you because it's cold, but what happens, maybe in the middle of the night you get hot and you don't know it, but half asleep, you're kicking off the blanket and maybe part of the blanket or most of the blanket's on the floor. And what if you're the type of person who gets up in the middle of the night to use the bathroom and it's kind of dark, but you know where the bathroom is, of course, but you don't know that you kicked off the blanket, your blankets or maybe pillows on the floor, and trip over that. So those are potential environmental risk factors that can lead to falls. Outside, now that it's changing season, the fall is here, we're going to have some leaves, beautiful leaves falling on the ground. And that's nice. It's nice, but sometimes they could be very slippery, especially after a hurricane or a rain or a storm, and there's wetness underneath there, and then you see the dry leaves. They could be very slippery underneath, or even the dry leaves themselves can be very slippery. So being careful about that, or crossing the street. In the Quincy area, there's a lot of beautiful constructions going on with the roadways and also the sidewalks, but the sidewalks look different. So being careful and making sure that you are aware of your environment at all times is very, very important. It's going to lessen your risk factors. All right, so how can we reduce our risk factors? So I just want to share with you in the slides, what I've been talking about are very general. There are other factors that can be added to the slides, but I just want to make sure we keep to the time because I want to be able to share with you some exercises that we could do. And I want to share with you something that I love to do in the morning, also the exercises that I do, the stretches that I do in the morning. So I want to add that to the exercises. So tune in, stay with me here. All right, so ways to reduce our risk factors. Well, some of them are, actually all of them. You will probably look at my slide and say, these are, of course, these are no-brainers. But sometimes we forget with stress or things that's going on out there in the world, in our lives, with relationship, family, or personal problems, we forget about these normal or common risk factors that we could do to reduce our risk for falling. Okay, so regular checkups, okay, going to the doctors regularly is very important, okay? And also, if you're not feeling well, going to see your doctor, calling them first, and then being seen is very important, because there was a drop in doctor visits and ER visits during COVID, okay? Because people were afraid to, is it okay to go? Is it safe to go to the hospital? Is it safe for me to leave my house? And, there's so much uncertainties, and there was such a big fear factor out there during COVID. So there was a drop in people being seen at the hospital. Normally so, but just know that it's safe. Just wear your mask and make sure that if you are going to be seen, that whoever's going to see you is expecting you, okay? Because right now in the hospitals, this is all hospitals, all clinics, you can't just show up without being expected. Unless, of course, you're coming from the EMS is bringing you. But even with that, the EMS people are calling ahead the hospital so that the hospital is expecting you or that person to arrive. So wherever you're going, just make sure that you are expected to, that you're expected there. All right, so checkups with your physical, going to regular physical, eye exams, very important, okay? Ears, hearing, and if anybody sees a therapist, very important to see the therapist. Especially during these days, there's a lot of concerns about mental health. All right, so very important to have somebody like a therapist, check on you, and you stay on top of the medications that you're supposed to be taking, so that way you're feeling more safe and in control in your body. All right, so the other one is daily habits. Basically, that is my tip for that is move more, do what you can, know your body, but do more, okay? And then the third is environmental. Just making sure wherever you are, you know where things are, and pretty much at least you have an idea of the integrity of whatever it is you're around, whether it's the ground, of course, being careful if you're walking on the sidewalk and there's bricks. Those are beautiful, but sometimes those bricks they pop, or some of the bricks maybe have cracked. So in the integrity of the surfaces that you are going to be walking on is very, very important. Whether it's broken, cracked, or slippery, be very careful. All right, so exercises, okay. So these are recommended by the NIH, and basically the exercises that's recommended for all of us. Okay, and by the way, all the information I'm sharing with you is not just for the aging, the seniors. This is for people like myself, everybody, 50 and up, I'd say. These are just basic recommendations. So exercises, there are different areas of exercises that's very important to touch upon. Before I became an injury prevention coordinator, I thought exercise was just anything that you did to move and maybe sweat, which is still true. But I didn't know back then that there's different components to what makes for a really robust and holistic exercise program. And after learning them, it just makes so much sense. So exercising, doing movements or activities or exercises that really strengthens the balance, because without balance, what's going to happen? Oh, let me just see, somebody is clicking. Oh, all right, I'm admitting another person. Okay, great, sorry about that. Welcome, thank you for joining. All right, so balance, exercises that has to do with balance is very important. Flexibility, very important, because we're made to move, we're made to stretch, we're made to twist, we're made to look side to side, okay? We have joints all over our body, and that's so that we can function the best we can and be able to look around and study and know and sense what's going on around us, okay? That's to keep us safe. All right, flexibility, so that's flexibility. Endurance, being able to have that stamina to do what we want to do so that we're not winded halfway and not able to participate, okay? So endurance is very important. And strength, as we get older, our muscle mass goes down, okay? It goes down a little bit, and they call it sarcopenia. So our muscle mass kind of shrinks a little bit, and that's why we kind of get a little bit weak. But it doesn't mean we can't keep on doing exercises that's going to preserve the muscles that we have, okay? So very important to have all these 4 elements. All right, so if one was not there as part of our regular routine, then you see how it just seems very incomplete. Without balance, we're more likely to fall and tip over, right? Even though we could be doing flexibility exercises, endurance exercises, and strength-based exercises, without good balance, that can lead to falling, okay? Okay, so this is just another graph that shows if we're not doing a balance exercise or endurance exercise, but we're doing strength and flexibility, it's still not going to give us that nice, robust program or regimen that's going to keep us really strong in our body. Okay, so the goal is really touching upon all these different elements to make us really feel strong. All right, so a recommendation by the CDC is for the aging adults to move at least 2.5 hours, and this is added on to what you normally do, to do an extra 2.5 hours of moderate to intense aerobic activity every week. So adding 2.5 hours of moderate to intense aerobic activity every week. And also to include muscle strengthening activities on 2 to 4 or 2 or more weeks, okay? And that's your major muscle groups. That could be your thigh muscles, your hamstrings, your buttocks, it could be your arms. So these are the major muscle groups that you would use to help you move up and down the stairs, get up from the chair, lift things, pick up your groceries, put things away. So these are what's recommended. And as I mentioned before, I do a lot of programs out in the community at the Kennedy Center. I've been there. I've been at the Milton Council of Aging. I've been at the Fennell House. I've been in different locations in Quincy, in Norton, in Boston, Milton, a lot of different areas doing a lot of falls prevention programs. And I can tell you a lot of the people will look at this and say, oh my gosh, are you kidding me? How is that possible? How am I going to do that? Where am I going to do that? What can I do? How can I get started? Good questions. I always say, know what your baseline is, know what your routine is, and just start small and just start doing something new and just keep building. Okay, you have to make it realistic for yourself, because that recommendation is great, but not everybody can abide by it. It may not be realistic for some people. For others, it might be like, oh yeah, I do that all the time. I go to the gym all the time. I run all the time. I've been a nurse for over 30 years, and there was one nurse that I used to work with. I worked with her for maybe 20 years. She's retired now, but even in her retirement, she runs like 3 miles a day all year long. Yeah, so everybody is different. Everybody is different. So know your body, know what you can do, and just start adding something extra, okay? So endurance, activities you could do with endurance, something fun like dancing, or it could be bicycling, or it could be, if you go to the gym, the rowboat, the rowing machine, or it could be just fast walking, okay? Not everybody needs to be running a marathon. If you do, that's great, but just activities that's going to really challenge your heart and lungs and circulatory system. And again, before you do any exercises, be sure, oh, we have another person joining us. Hello, welcome. All right, so before you do any of these exercises that I'm going to be sharing with you, always know your body, okay? Know what you can do and check with your doctor, because I could be sharing something with you that sounds so common, you know, it's like, oh yeah, I could do that. But if your doctor is telling you you can't do that for another 2 or 3 weeks, please follow that advice, okay? So any exercise that falls under the endurance part helps the heart, the lung, circulatory system, and helps with the stamina and also deep breathing. All right, so again, an example is walking. All right, strength-based exercises, anything that you know, like if people have weights, okay, you could use that. Or if you have, some people use cans, they could use that for weight. Some people have the resistive bands from physical therapy. Those are really good as well. All right, so they help with our muscles. It helps our muscles become more toned. It helps our muscles become strong, and helps with grips, mobility, lifting. And I mentioned earlier about sarcopenia, how that muscle just start, as we get older, once we start hitting like maybe like 30, 40s, our muscle starts kind of shrinking a little bit, okay? But unfortunately, our fat mass goes up a little bit. So a person that you have may look like, as they're getting older, they look the same, but in their body, it might, their muscles might have shrunk a little bit, but the fat mass might have increased. So it can be deceiving, and that person may not be as strong as before. All right, so all strength exercises could be arm lift. You could be doing exercises like on the chair, lifting yourself up from the chair, okay, or up against the wall or on the table, just doing any type of weight resistant type exercises is good for your body. Okay, flexibility is very important as well. If people do yoga or any type of stretching exercises, that's very, very good, because it helps with our joints, helps with our muscles, it reduces aches and pains. All right, so flexibility exercise, we'll be doing one momentarily. All right, and balancing. Again, balancing exercises are very, very good. It helps with our balance, keeps us from falling. All right, so here's an exercise here. A person is standing on one foot and then they alternate with the other foot. So I'm going to, this is what we just covered. So what I want to do now is I want to spend the rest of the time doing some exercises with you. I know we will have maybe a few minutes, but I do want to share with you some exercises that we can do together. All right, so one of the exercises that I like to do, especially in the morning, is called it's called a daily energy routine, And that is created by Donna Eden. And this particular routine is something that involves coordination. It involves being, you know, moving the energy in our body in a way that's making it like flow the right way, because sometimes the energy in our body is flowing a little bit differently, and sometimes that makes us feel kind of scattered or you know, a little bit not focused. So I like to start my morning with an energy routine. So I'll share with you a few steps with that, and moving forward in the other series, I will build on to the steps that I teach you under the daily energy routine. And Then what I'll do is after I'm done sharing with you the daily energy routine, we'll do a little bit of some warm-up exercise as well that touches upon endurance, balance, flexibility, and strength. Okay, so first of all, I'm going to move a little bit closer. All right, I think what I will do is, before we do that, I'm going to advance the slide just so people could see me a little bit better. All right, I'll end the slide presentation now so that way you could really see me better. All right, so this is basically what we covered. I talked about falls, what they are, risk factors, how to reduce it, and the exercises. All right, and thank you. And I'm going to end the slide right now just so you can see me better. There. Close. I like to see people when I'm doing programs just so I'll know. All right. All right. Just God knows. Continue exercises. Okay, so that's a good question, Pam. And so what I'm going to recommend is, I don't know where you are in that journey that you just mentioned. Definitely check with your doctor because movement and any type of exercises is really good, not only for the body, but also for the mind, okay? But definitely check with your doctor and your nurses about that. Okay, so what we're gonna do is we're going to start tapping underneath the eye here. So this is the daily energy routine part, okay? And this was created by Donna Eden. I've been doing the daily energy routine since I was in college, and it does really help. And I like to do it in the morning. And then if I need to do it again during the day to help me focus, or if it's been a stressful day, I do that. So you tap underneath your eye, and every once in a while I'll move closer to the camera so you can see me. All right, and some people, they either tap or they rub. Okay, I like to tap underneath the eye. And this here is in her energy medicine system is, and by the way, this is kind of an add-on bonus, okay? And so under the daily energy routine by Donna Eden, she basically touches upon the different acupressure points in the body, okay? This helps with grounding. It helps us feel strong in our body, okay? And as we're doing this, we're going to take a nice deep breath. And today we'll do the 4 thumps, okay? Okay, so that's the first thumb. And then here on our clavicle, right here, clavicle, we tap here. This is near the lung points. Remember, taking a nice deep breath. And as we're doing that, the great thing about breathing, and I'll do more breathing exercises next week. The great thing about breathing is we take it for granted, but if we're not breathing properly, then we're not bringing oxygen all over our brain, our body. And our body, the brain, every part of our body needs oxygen in order for it to be nourished and to have that energy. Very important. Okay, so there, again, some people like to rub. I like to tap. And then on the breastbone, on the sternum, is another point, okay? And that's to activate the immune system. We have a thymus gland that's sitting kind of on top of our heart. And it's good to activate that, especially around this time with the pandemic or the changing season, and flu season's coming, and then people are worried, well, I need the flu shot, I need whatever it is, and if people start coming down with something, they don't know if they have the flu or something else. So it's the best way to really take care of ourselves during this time is to keep ourselves healthy. All right, so tap, 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 and you know you're doing the right job is if your voice sounds like this. I know you're muted, I can't hear you, but you can hear me. Okay. All right. And then the fourth step under this, the four thumbs, is underneath, oops, right here, mid-axillary is what we call it, right here. If this is your armpit, right? So right in the middle here, and people who wear bras, okay, it's like on the bra line, here or underneath, okay? And these are points that helps, they're like spleen and liver points in the acupressure world. These are good for metabolism, metabolizing things that we put into our body like food and drinks, and also metabolizing feelings and thoughts and energy that we take on from other people. That's good for metabolizing. Breathing. All right, so just kind of shake it off. All right, so that's just one part of the daily energy routine. I'll teach more in the next few weeks because I think I'm talking too much. So much to share, so many good stuff to share. All right, so as far as the endurance part, okay, the endurance, we could just, if you could stand, I invite you to stand, and just always make sure you have a chair next to you in case you feel like you need to sit down. I don't know how everybody's activity tolerance is, so always have a chair with you, okay, to hang on to, and we'll just kind of march. Okay, just march. And maybe we could march for a minute. I have my little clock here. We'll just kind of march. And sometimes people say if you move your arm past your heart level, you're really challenging your heart and your lungs. But again, know your body, know what you can do and what you can't do. Okay, I'm trusting that you can do this at home so that you don't hurt yourself. You could do the marching sitting down too. Okay, so we have less than 30 seconds left.
Tell me about your favorite thing.
Making sure I don't hit my orchid behind me.
It doesn't. Tell me about
All right, we have, all right, 3 seconds and stop. Okay, so that's marching. That's the endurance part. And what we could also do is, if I invite you to sit down, because the next one here, we will do another endurance one. And what we'll do is we're going to stamp our feet really fast. We're going to stamp our feet really fast for 30 seconds. Okay? And what that does is it reminds our lower extremities that we can still move fast. Okay, you know how like football players or athletes, they do a drill where they do one of those really fast movements with our feet. That's so that they could really have a fast reaction. And this is really important because we're reminding our muscles in our legs that it can still move fast in case we do trip. You know, we've done our best, but you know, we just kind of like lost our balance. It's a nice reminder that for our legs that it can still move and catch us when it needs to. So let's do a 30 seconds. So starting now, just wherever you are, just sitting, and stamp your feet really fast. Okay? Stamp your feet as fast as you can. Fast as you can. Maybe if you could do it a little bit higher, and maybe faster. This is one of my favorite parts to do in my warm-up. So faster and higher. We have 5 more seconds. 4, 3, 2, and 1. All right. Raise your hand if your heart was pumping really fast during that. That's what we want to do, is really challenge the heart a little bit, right? Okay, so the next one is we'll do a balancing exercise. Okay, so the balancing exercise, what we will do is, if you're able to do this standing, and just either holding onto the chair or table next to you, and what we're going to do is Just raise one leg. You can raise your left leg. And maybe if you can let go of that surface, so that way you're really challenging your right foot to keep you up. And this is a good way for all your feet and toe muscles to really work for you. Okay, so you don't have to raise your left foot up too high, just off enough so that it's not touching the ground, but really where we want to see how strong our right legs is. Okay, and down. Shake the legs. And then let's do that to the left, okay? So keep the left leg down and right leg up just a little bit so that it's off the ground. Just make sure also that you have something to hold on to in case you lose your balance. And anytime you're doing any type of exercises, you might notice that one side is much stronger than the other, okay? So right now we're standing on our left foot, right leg, right foot is off the ground, and feel free to hold on to something so that you don't trip and fall. But if you feel like you want to challenge yourself a little bit and you think you could do it, try not to hold on to something. And let's do that for 3 more seconds. 1, 2, 3. Woo. All right, for the strength exercise, okay, I don't think... All right, so the strength exercise, we're not going to do that this week. But what I will recommend as far, well, actually, we can do something right now. If you're sitting on the chair, my chair has an arm to it, okay? I'm going to raise myself using my arm like this. Instead of letting my legs raise my body, I'm going to let my arms do that, okay? And what you could do is if you don't have any arms on your chair, you could just put your hands on the chair and just kind of maybe raise your body using the bottom part of the feet. So you're using the weight of your body to be the one that's causing the resistance, okay? So we're using our arm muscles here we're focusing on that area for strength exercises. Okay, good. And what some people do also is you could do, if you're sitting on the chair, and instead of using your arms to help you up, you could just kind of hold your arm up like this and just stand up and sit back down. Just make sure you have the chair sitting next to you. All right. And one of the tricks about this exercise is it's easy to just do one of these because of the momentum. But you want to be able to do it slowly and maybe stop halfway and then down slowly, okay? Because once again, it's easy to just do one of these because the momentum is going upward. And it's easy to just plop down on the chair. So you want to be able to just kind of slowly go up using both legs and then down. Okay, so strengthening the major muscle groups, very important. All right, flexibility, that's also a great thing. Again, we have our neck, very important that our neck has as much range of motion as it can. So we could practice looking side to side. And just do it so that you don't get dizzy. Okay, and then maybe looking down and up, down and up, down and up, down and up. And then maybe allowing your chin to kind of roll across your chest. See, when I do this, my neck starts cracking. It feels good though. Sounds like the Rice Krispie treats. Rice Krispies, I mean, crack. Okay, and then maybe putting your shoulders up like this, as close to your ears as possible, and then down, up, and down, and down, up and down, up and down. And then maybe we could reach for some stars. So we're stretching the side, stretching, 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 stretching. Can you feel that stretch on your side? Yeah. And then maybe reaching, 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 reaching. Good job, everybody. Good job. And then maybe down, like you drop something. Down, 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 down. Then let's do one more. Twist. We'll twist at the waist, sitting down, and just kind of putting your left hand on your right knee, and then the right hand reaching behind you on the chair, and just take a deep breath and twist at the waist. And hold it there for 3 seconds. 1, 2, 3. And slowly look to the front. And then right hand on the left knee. And then left hand reaching behind you. Let's take a deep breath. And twisting at the waist. Okay, and then there you go. That was good. That was good. All right, let's see here. I'm going to invite you. That pretty much wraps up today's segment. Okay, I invite you to come back next week. What I'll do every week is basically cover most of the key highlights that was covered the prior week, so that way it builds on. I hope to see you all next week. Okay. All right. Bye-bye.